Hello, everyone, and welcome to this week's COVID-19 office hours. I'm going to spend a couple of moments going over some tech notes, and then we will get into the content that we have for today. So a couple housekeeping reminders. We are recording the office hours today, as we do each week, and we will post a copy of the recording along with the slides and any content that we receive through the chat box on the HUD Exchange. Just give the team a few business days, and that material will be up there. If you have any issues with audio during the webinar, we encourage you to switch over from computer to phone audio at the numbers that are up there on the screen right now, as the telephone audio tends to be a little bit clearer for most folks. Everyone will remain muted for the duration of the office hours this week, but we absolutely anticipate and hope to hear from you through the chat feature in WebEx. So to find that, just take a look at the bottom right-hand side of your screen. You should see the word chat and what looks just like a message bubble. Click on that, please, to send all questions, comments, and feedback in. When you are sending those messages in, though, please do take a moment to make sure that the tube is sent to, to everyone. That'll make sure that all participants, as well as panelists and presenters, can see those messages. I also want to mention that again this week, we will be asking you to respond to some poll questions. There are actually 3 poll questions included in the one link. They are about emergency rental assistance, or ERA, and we will talk about that towards the end of the office hours. With that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm?
Thank you so much, Natalie, and welcome everyone to the office hours today. We have a great set of presentations we're delighted to be able to share with you today. As Natalie mentioned, please just jump into those poll questions and fill them out. You can click on that link anytime during the presentation to fill those out. Provides helpful information for us and also gives us a nice bit of stuff to talk about near the end of our session today. So I'm quickly going to introduce some of our speakers today. So you can see some of the staff that will be either speaking or answering questions in the chat window. We're also very happy to have a presentation from Tehama County, California. Andrea Curry will be speaking with us today, so we're very, very excited about that. We have a great set of technical assistance products. We'll be hearing from Jill Robertson about those. We'll have an update as well on ESG/CD spending, and we have a great presentation on some visualizations that we will have for you near the end of our session today. As always, please jump in and, and I obviously forgot to mention our update from Emily from the Centers for Disease Control and Prevention. Sorry about that. As always, please type in the chat window any questions you may have. You can type them anytime. We will try to answer as many of them as we can, either in the chat window or out loud during the presentation. And with that, I'm just going to jump right into our content here. I'm going to turn things over to Emily Masitas from CDC to give us our COVID update. Emily?
Hi, everyone. Really good to talk with you all today. We are having a storm here in Atlanta, so I want to apologize ahead of time if I get cut off for any reason. It makes things more exciting though. Next slide. All right, so our national case trends, we are still looking pretty good, just a teensy bit of a flattening off in the last week or so of our case counts, but expected a continued downward trend based on our forecasting. Same with emergency department visits for people experiencing homelessness, and outbreaks have been pretty quiet. Next slide. Still looking good, heading upward on our vaccinations, highest levels in the Northeast. Still have a little bit of work to do in our mountainous region and in the South. But overall, things are heading in a good direction there as well. Next slide. So what I want to talk about this week is that we just put up a new update on the guidance for approaches to COVID-19 prevention among people experiencing unsheltered homelessness. So very happy to present this update. It is a similar format to the update for shelters. So I'll go through each of the components. So the underlying principles are very similar as well. We want to consider the indicators for when to start changing approaches together. Of course, discussing with community partners, especially when we're thinking about unsheltered homelessness, is very much a community-wide decision-making process that needs to happen before any changes occur related to COVID-19 prevention among people experiencing unsheltered homelessness. We still want to think about doing things in a phased and flexible approach so that things can be potentially changed again if needed, if the context changes. And then finally, of course, connecting people to permanent stable housing should continue to be the primary goal. Next slide. All right, so going through our indicators again, just like with homeless shelters, community transmission levels are really the primary indicator that we want to be thinking about related to changes in approach to COVID-19 prevention among people experiencing unsheltered homelessness. In particular, because for people experiencing unsheltered homelessness, the risks are they're different in terms of where they might acquire COVID-19, so not being within a facility. So I would still advise, being in touch with your local public health authorities, and also we have the COVID-19 data tracker on the CDC website that tells you your county level data. Being in the blue zone is a pretty good zone to be when starting discussions about any changes to approach here. Next slide. We also want to think about vaccination among people specifically experiencing unsheltered homelessness. This is even slipperier to think about than when we're thinking about people who are accessing services in shelters. It's difficult to know what the actual coverage levels might be. It's also, we also don't have an exact metric of what coverage should be for us to feel assured that transmission is not going to occur. So for this, I would say that what we want to be thinking about is how well did we do outreach to provide vaccination for people experiencing unsheltered homelessness? We might not know what our coverage levels are, but how was there and do there continue to be efforts to provide vaccination for people? Next slide. And finally, the third indicator, when we're thinking about unsheltered homelessness, it's labeled here as housing availability. It has a little bit more to do with thinking across the community, what is going on in the community related to housing, related to shelters, considering the whole system here, because what needs to happen is people need housing. So thinking about the whole system at once whenever any changes occur, and this really has to do with when we're thinking about approaches to encampments and moving people who might be in encampments, thinking about what that system looks like if there's a change in approach to encampments without an understanding of what's going on in the rest of the system, that's a space that we don't want to be in. So that's where those community-wide discussions need to be held and things move forward in a careful way. Next slide. All right, so just like with shelters, there's some baseline measures we always want to keep in place when we're thinking about unsheltered homelessness, monitoring community transmission of COVID-19 in the area and being able to respond if there are increases in cases, keeping flexible quarantine and isolation locations. That is still going to be incredibly important to be aware of where people can quarantine or isolate if they need to, because if cases go down and we close everything in terms of our quarantine and isolation spaces, we will be in trouble if cases go back up again. And then finally, keeping a minimum set of public health prevention and control measures in place. This is going to be really important related to overall sanitation in encampments, ensuring access to hand washing facilities and supplies. And then linkage to care is incredibly important for people experiencing unsheltered homelessness. And so that's it for me. I think that's the last slide. I would be happy to answer any questions. Thanks.
Thank you so much, Emily. And again, if you have questions for Emily, please feel free to type them in the chat window. But I think something you sort of hinted at, Emily, I think is really important, which is that some of these infection control measures that we've put in place are really things that we should have in place permanently, not just for COVID, but for other, there are other infectious diseases that that we should be paying attention to all the time. So I think that's a really important point. How do you recommend that people sort of think about that? Is this the chance that they should leverage the relationships they've built with their public health department to sort of think about what a permanent sort of public health focused infrastructure might look like?
Yes, absolutely. So I think, you know, probably everyone on this call, we're probably all on the same page that we don't want things after the pandemic to go back to the states that they were before the pandemic. We know that there have been infectious disease outbreaks across the board, both in shelters and among people who are experiencing unsheltered homelessness. A lot of the systems and things that we put into place for COVID can help protect people against other infectious diseases too. So having those community-wide discussions about where do we want to be, how are we going to protect people going forward is incredibly important. And we are fully on board with those conversations as well. So if there is any need for CDC input or discussion, we'd be happy to be involved in thinking through what that looks like as well.
Thank you so much. I think this is incredibly helpful information. And between last week's update on the shelter guidance and this week's update on the unsheltered guidance, I thank you so much for everything you've been doing to help us get through this. We're going to move on to our next presentation now. I am very happy to introduce Andrea Curry from Tehama County, California. And we have a great presentation coming up on supporting survivors during the pandemic. So Andrea, I'm going to turn things over to you.
Great, thanks, Norm. And thanks to everybody for being here today. I am Andrea Curry. I'm with Empower Tehama in Red Bluff, California. So Empower Tehama is primarily a victim services agency, but we also serve as our COC's lead agency and HMIS administrator. So we're a little bit of a unicorn there with a foot in two very, very interconnected worlds. So next slide, please. Great, so this is just a little bit about Tehama County. We are up here in the northern part of California, further north in San Francisco, but south of the Oregon border. So we're a very small, oh, can you go back? Pretty rural county. We only have about 65,000 people in the entire county, and about 2/3 of them live in unincorporated areas, and some of those are pretty remote. About 17% of all Tehama County residents live below the federal poverty line, and homelessness is a growing issue in our community. But our overall system for providing services to people experiencing homelessness is small, but it's expanding. We're in that growth phase right now. Think about 700 households total were served in our overall system, including our DV housing system in 2020. So we're still pretty small, but we're trying to get a real comprehensive set of services available. So next slide. A little bit about what we do overall as a DV provider. Housing is part of that, but it's important to realize that we have a whole menu of services for survivors. Not all of our survivors are experiencing homelessness, and most of these services are open to anyone who is a victim of intimate partner violence. So those include our crisis hotline, crisis intervention, safety planning, legal advocacy, some assistance with civil and family law, and court accompaniment, and then court and social services advocacy, And emergency food and clothing and household establishment assistance, that's just kind of some, in the moment financial assistance or in-kind assistance. And we do provide counseling and support groups and serve as a community referral resource. But what we're really here to talk about today is our housing programs for survivors. We have a comprehensive housing program that includes emergency shelter, transitional housing, and then our rental assistance program, which assists with permanent housing. About half of the survivors that we serve in a year's time at some point will be displaced due to domestic violence, but not all of them meet the full definition of Category 4. Some of them do have the resources to self-correct or the support system to help them get into safe housing. But the ones who do need assistance with that, that's who gets enrolled in our housing program. So next slide. Most of us are familiar with assessing vulnerability through our coordinated entry systems. And we interact with our coordinated entry system a little differently than most of the programs, in our community. So if a survivor calls 211, which is our entry point, and reports being a victim of domestic violence and reports currently fleeing domestic violence, 211 will divert them to us if the survivor chooses that. They can go into the coordinated entry system and get on the by name list if they would like. They can be referred directly to us, or they can do both. We really do want to make sure that survivors have all the options that anyone else does, but then also options that are specific to addressing domestic violence. When a survivor does get to us, just about all survivors, but particularly those who are in need of housing, we have a set of additional vulnerability factors that we assess on. And one of the most important is a lethality or danger assessment. I know that a lot of us have talked about a regular coordinated entry in terms of prioritizing who's most likely to die on the street. And with survivors, there's that added danger of being in danger of being hurt or killed in their current situation, regardless of whether they are, where they're at. So that's a really important one that we assess on. We also discuss and assess on the potential escalation of risk. The time just before, during, and just after escaping a domestic violence situation can be the most dangerous time in that entire experience. So we do assess for that, and that can help. Assessing for that can help us work with a survivor to determine whether being housed in the community right away is a good option, or whether something like our on-site transitional housing, which is more secure, is appropriate. So, and then of course things like access to resources and access to natural support. So next slide. Just a little bit about the breakdown of the folks that we do help with housing. The bulk of the folks that end up getting housing assistance through our program do fall into the extremely low, 30% or less of area median income, but we do have a little bit in different places. Some of this is actually influenced by financial abuse. So if you'll notice, we do actually have like a tiny percentage that's up in that higher, greater than 80% area median income. And it's important to realize that just because a survivor may have that income, it doesn't mean that they have access to that income immediately. Retaining control over a survivor, over a household, is really something that we see a lot, especially when it's clear that that survivor is leaving the relationship. So next slide. So a little bit about how COVID has impacted survivors. We noticed something that was really alarming, really concerning right at first in March when the stay-at-home orders were announced here in California. And what we noticed was that new survivors coming to us, the number of those just plummeted. Now, we did remain open. We run a crisis center. It was not something that we could close down. And so we did remain open, but what we were seeing was that people weren't coming to us. And that was really concerning. our experience really told us that it was probably not that domestic violence had ended. So we did look at that to see, and it was a pretty logical explanation. Survivors tend to come to us during times where they can escape for a minute. They'll call us on their lunch break at work. They will come by, they'll drop in after they drop the kids off at school or when they're supposed to be at the grocery store. They generally try not to bring their kids in with them because they're going to be talking about some stuff that they might not want to talk about in front of their kids. And just being able to leave the house. I know a lot of us take that for granted, that we can walk out of our house anytime we want. We can go anywhere we want. We can go visit our mom. We can go see our friends. And survivors generally don't have that to begin with. So when those stay-at-home orders came down and no one was supposed to leave their house, it became much, much harder for them to reach out for help. But as we'll talk about in just a second, if you look there at about June 2020, it shot right back up to about where we normally were. Next slide. And when it shot back up to about where we, about the number that we were used to getting, we noticed a significant increase in the severity of the cases that we were seeing. A significant increase in the severity. And that was, what we were finding was that survivors who may have ordinarily reached out for help before things got to a point where they were in fear for their lives were not. There was some confusion when those stay-at-home orders told us that we shouldn't go out except in cases of an emergency or necessity. Deciding whether or not they were in an emergency situation became something that was really difficult, I think, for survivors to do, which is difficult to assess when you're in that situation anyway. And so their access to folks that might usually refer them to us was cut off. If anybody here tried to go to the hospital or to a medical clinic during those first 3 months, first few months, it was, you got there and it was a hazmat zone. You couldn't just go in and see a doctor who might ordinarily be able to say, hey, I can, see something's going on. If here's some information to get to the DV agency if that's what you need. That just wasn't there for several months. And also their access to their natural supports, their family and friends, was really cut off. And a lot of times family and friends are the ones who can see from a close but outside perspective that a person needs help and encourage them to get it. Okay, next slide. So there were a lot of impacts actually on our housing programs as well, which I'm sure that any of you who operate within housing programs of any sort noticed a lot of the same things that we did. Our shelter capacity had to be decreased. We have I call it a semi-congregate shelter. We have family units and we have a small dorm for single adults. And the logistics of keeping people from having close contact from different households was really difficult to manage. So, and then bringing new households into shelter was just a logistical problem because we had to make sure that we weren't putting the people who were in shelter in danger of exposure and the like. We did have one incident where our entire shelter was put under orders of quarantine, which was, again, logistically very difficult and also stressful, especially on the children that we had in shelter. So our shelter lengths of stay really did increase. We ended up kind of starting to use our on-site transitional housing more as non-congregate shelter because we could move families out to that pretty quick, which meant obviously that we had to open up units out there. Our transitional housing has small 2-bedroom self-contained units, which can hold a household without them needing to use common restrooms or common kitchens, that kind of thing. So it really did change the way we operated on that level. We ended up using much more motel sheltering than we normally do. As you can see from this chart here, we do have a protocol for using motel sheltering when our shelter is full. When in an emergency, we need to shelter someone quickly in the middle of the night or the wee hours of the morning. But as you can see, our shelter bed nights were pretty minimal right up until we hit about July 2020, when that was right around when our shelter went under quarantine that one time. And we started realizing that before we could bring anyone new into shelter, that we needed to put them in a motel first. We needed to get them medically cleared before we could bring them in. We needed to have space for them. So that was an increased cost that we really noticed. That has started to go down a little bit, and that one of the reasons for that is our community has the COVID testing has gotten much faster, and also because of vaccinations, we've been able to get folks into shelter faster in new households. One of the other things that has impacted the length of stay in our shelters is that access to the stabilization services that we were used to being able to get people connected with very quickly, where that decreased there for a while. Next slide. Okay, so the impacts on our permanent housing program, I'm sure that many of you have seen these same things with property management offices being closed. And we really did have a lot more, an increase in the number of households that needed our assistance, essentially due to mostly the economic impact of the pandemic, with folks losing their jobs, it being harder for them to go out and get, new employment. But at the same time, there were fewer units available for our folks to move into, and because there were so many people looking for housing, increased tenant screening became a factor, where if a landlord had their pick of many applicants, then our folks weren't as likely to rise to the top of those processes. Okay, next slide. Throughout the pandemic, we know that we've had a lot of problems, and we've had to change things around a lot, the way we operate. But there have been a few things that the pandemic has brought to bear that we hope to keep. One of those is the telephonic option for a lot of court appearances. That's been really helpful for a lot of our survivors who have, for good reason, have a lot of fear about being in the same room with someone who's harmed them. Telehealth and telelaw formats for survivors in remote areas, those have been great. The pandemic, at first, not being able to provide in-person therapy and legal services really prompted us to put in place those processes for providing those through distance formats. And those have worked out really well for a lot of our survivors in remote areas, and even those that we have helped get housed in communities who may not have transportation. It's great to be able to check in with them over distance formats. Now that, and then, of course, wash your hands. That's been a great one. We definitely want to keep everybody washing their hands. The other one that I wanted to point out was really a defaulting to empathy. And it's something that we really noticed here in the DV field, because it's something that we keep in our mind with our survivors that we're working with all the time. But there has been a general acceptance in our society that, hey, people are going through some stuff. Let's give everybody a little bit of grace. And that's something that we do hope that will continue for our survivors and for everyone in general. And then also when it comes to our services, additional funding like ESGCV and just the speed and creativeness that has come with trying to react to the pandemic for providers like us and other housing providers. We've really seen some great things come out of that increased capacity, and especially that attitude of let's all innovate and get things done and adapt quickly. So we'd love to see that continue as well. And so I think, next slide. I think we're down to the questions portion.
Thank you so much, Andrea. A lot of great stuff there. I have a couple sort of topics I wanted to follow up with you on. One, and this is a little sort of I don't know, tangential, but it looks like over the course of the pandemic, you've had to work with people in a lot of different shelter type settings. You've had hotels, you've had congregate, you've had transitional housing. Can you talk about, for survivors, what were the sort of, have you had any reflections on going forward, how would you do sheltering for survivors differently based on what you've learned from their comments and their experiences in all these different types of settings?
Well, I think that we did find that having the transitional housing units to use, as a non-congregate shelter kind of led us to look at things a little bit differently on transitional housing. Usually our transitional housing option is for survivors who aren't who it's not safe for them to move out into the community, but we really tried to stick to that, you're going to be in transitional housing for 6 to 24 months. And because we did have to kind of speed up some of those in order to be able to, fill the need and keep families moving through, being open to the idea that not everyone needed those full 6 to 24 months, that was a great experience that we just hadn't had an opportunity to have previous to that. So that was good. In our shelter, with regards to preventing the spread of infectious disease, we did find that there were a lot of things that we hadn't thought of before that would be good practices always, disinfecting things. We've even kind of looked at how do we get more bathrooms in this building, which turns out not to be nearly such an easy thing to try and make happen. But we really did find that some of our survivors wanted to stay in shelter longer because they felt safer with the camaraderie that came with being in a communal situation. But then for some, they wanted out of that communal situation as quickly as possible, partially due to the fear of COVID spreading in there again. So there were several different lessons, and I think that my housing staff could probably answer those a little better. They probably got anecdotes and everything. But I think that, like I kind of said on that last slide, that being able to innovate, almost having the permission to do things differently and see if they worked, that has been something that we've learned that is really valuable.
Great, thank you. And I also wanted to follow up a little on the telehealth and telecase management topic, because this is particularly for rural areas. This is an area where, I don't know, feels like we've learned a lot over the past 12 months. So do you have any takeaways and recommendations for people about how to approach like telecase management and telehealth, and sort of recommendations for how people should think about that going forward?
Well, first of all, I do have to say that broadband, we need full coverage broadband everywhere would be really helpful, and because that was something that we saw marginalized communities that, based on just their literal location, some folks could get better services through distance formats, but we did find that distance formats with therapy is a great option for some people and not an option for some people, and that was a personal preference kind of thing. We did notice, because we do a lot of children's therapy actually, and we did notice our clinical director could now tell you the age breakdown of, don't try it with this age group. This group, the teenagers actually love it, a lot of them. So we did find that it was helpful for some, not for others. And with legal, our legal staff actually ended up really appreciating being able to do that, their services over the phone or over video conference, because it didn't mean that that survivor they're working with had to load up all their kids and bring them all in to sit down and do this. Mom could sit down in her bedroom and talk to her legal advocate, and with half an eye on the kids, and that kind of thing. So it was really, really helpful for their clients.
That's great. Thank you so much. A lot of great lessons there, and I very much appreciate you joining us today. If you have any more questions for Andrea, she's going to stick around for a while and answer questions in the chat window, so go ahead and type them in there. We're going to turn to our next presenter. Very happy to introduce Jill Robertson. She's going to continue on our theme of better serving survivors and talk about some technical assistance resources we have. So Jill, I'm going to turn things over to you.
Thanks, Norm. Really appreciate it. Hello, everybody. Hope you're having a great Friday. Just want to highlight a few things before I get started. I'm Jill Robertson. I'm with Collaborative Solutions, one of your HUD TA providers. Also wanted to mention, didn't get it on the slide, but did want to mention that I'm a part of the Domestic Violence, Housing, and Technical Assistance Consortium. And we provide all kinds of TA around domestic violence, sexual assault, sexual violence. So please feel free to reach out to us either directly, or you can go to safehousingpartnership.org if you have any specific questions or needs. I'd be happy to support you. Today, I wanted to just highlight a product that has been done in the past. It is the Special Populations Rehousing Strategy related to family violence. So let's take a look at that. Next slide, please. So this product was developed a couple of months ago, but there are some very relevant points that we can share today, and just want to lift this product up to you. You can find it on the HUD Exchange. So during this pandemic that we're all still living through and dealing with, there have been an increase in risk factors for domestic violence and child abuse, and we're still dealing with those things. Some of those specific risk factors include reduced access to resources, lots of reasons for that, possibly in some cases funding not getting down to the local level. Tons of increased stress, not only at the family level, but financially and in housing in particular. So some added stress there, the financial difficulties, and then that social isolation. Andrea mentioned that and talked quite a bit about that. So just a really pressing factor in on people as their families are dealing with the pandemic. And another thing that I just wanted to share is that and many of us already know this, but those pandemic risk factors have really increased the risk of violence and isolation and death towards people in historically marginalized communities. So that's something, as especially a part of a COC or even in a community, we need to be aware of that, be watchful and considerate of people around us in how that might be impacting them, and hopefully drive them to some resources to get the support they need. One thing we've heard in the domestic violence world is that based on some loose statistics, it's projected that possibly even up to there's been up to 150% increase in domestic violence during the pandemic. I don't know if those figures have been firmed up, but those are some of the numbers that I've heard, and that's pretty scary. It's happening everywhere in our communities. We also know that with the eviction moratorium potentially ending, that risk factors are going to increase, and domestic violence and child abuse could also see increases as well. Let's go to the next slide, please. So let's consider some survivor-specific needs that you, especially as a part of a COC, might want to consider. So we've all been thinking about both the physical and mental health concerns, but safety concerns for survivors is extremely important. That coupled with confidentiality are probably the two most serious considerations that any of us that are working with survivors really need to take to heart. That means that we need to be thinking about whether our actions as we try to help people helps them, or if it really puts them in harm's way. So one thing we can do is we can really connect survivors with permanent housing solutions, whether that be rapid rehousing or even some of the American Rescue funds might be a possibility, or the new EHV vouchers that are coming out, are starting to or will soon be coming out. So we want to just really connect survivors to those permanent resources and help them. The other thing we want to really do is just make sure that as a COC, we think about how to maintain our confidentiality. While we do have responsibility to do data collection, let's be thoughtful and let the survivor drive the decision making in terms of the data that they choose to share. Let's go to the next slide, please. So let's think about how we might plan and coordinate around survivor needs. One of the best ways that we can do that is looking to our leadership across the communities. Excuse me. We can look to our ESG recipients, the leadership there at the city and state level. Also, COCs provide a great resource of leadership, so we would want to look to that source of leadership. When it comes to serving survivors, your state coalitions and your domestic violence programs are going to be able to offer a wealth of information. We really want to invite them to the table and make sure that their voices are heard in the decisions that we're making to get funds out, especially to survivors. We really want to invite culturally specific organizations to the table as well. They have much to teach us and much leadership to offer. So let's make sure that we're including them as we strategize and we design our programs. And then another and very important consideration is let's make sure that lived experience is a part of our strategy. It's also should be part of our program design. The people that really know the best about what's needed are the people that are actually surviving or are in the midst of this particular crisis. So let's ask them, let's look to them for leadership. So one thing that in the HUD world that we talk a lot about is about data and how we use the data to drive our decisions. Well, this is a perfect place where we can look at our data, we can disaggregate it by race, gender, LGBTQIA+ status, and really see what our community needs. What kind of housing is needed within each of those communities, and let's do our part to make that housing available. Also, ESG recipients can work with their DV leadership, which I kind of mentioned, just to make sure that there's no victim service providers that are penalized because they're not collecting specific pieces of survivor data. Possibly survivors are saying no to certain parts of the data collection, or maybe for whatever reason, it's just simply not safe for them to share that. So let's not penalize our DV leadership. Let's make sure that they get funded and that they have resources to help survivors in the local community. And then lastly, let's make sure that we actually train our homeless service providers so that they are sensitive to survivors' needs, so that they provide trauma-informed care and that they have really good listening skills. I know Andrea mentioned that, just super important for us to be listening, to be empathetic. But let's make sure that everyone knows how best to serve survivors, because survivors are going to show up not just at victim service provider doors, but at homeless service provider doors as well. So we all need to understand the best approach and the best way to support survivors. All right, let's go to the next slide, please. So let's take a look quickly at how we can revise our practices to increase housing access. So one thing that ESG recipients and COCs can do is they can increase their access to funds for providers from that have a history of serving survivors, or those that serve dating violence survivors, sexual assault, stalking, human trafficking. Let's make those funds available. We have a lot of resources in the system now, and we want to make sure that everyone has access to those. Let's also work together to build capacity for victim service providers. And that can mean a lot of different things when it comes to building capacity. But when you look at especially any marginalized communities, they may not have had federal funds before. So let's work with those populations and make sure that they have access to the funds, but also they know what they need to do, how to do the documentation, how to use a comparable database, all of those things that are necessary with federal funds. And then I mentioned before, let's train our homeless service providers to adapt their service delivery to meet the needs of survivors, especially during this pandemic. One thing I really want to charge everyone with is now is a really good time to look at your coordinated entry policies and see if there's a different way of doing an assessment. just to make sure that number one, it's safe and confidential, and number two, that survivors are actually getting into housing. They have critical needs to be safe and to keep their children and families safe. So let's be adaptable, let's be flexible, and innovative, as Andrea said. Let's bring those things to the table. And then one last thing is that we can take a look at maybe the ways that services are, or even subrecipients are providing support to survivors. One thing that Andrea highlighted that I really loved was the telelegal services. So right now, especially with the eviction moratorium being about to be lifted, this is going to become super important that people have access to legal services. So for those attorneys that might be listening to this call, or for those of you that might know them, this might be a great way of providing a resource to somebody that might not otherwise have access to legal services that would need it. Also, we can make resources available for credit repairs or rental arrears or even housing search and placement. And for survivors, all of these things, all of those unique services are really critical to keeping them safe and confidential. Well, I've talked a lot, and so again, just invite you to reach out and feel free to ask any questions. Be happy to help you.
Thank you so much, Jill. I wonder if you could talk a little more about the Safe Housing Partnership and the Domestic Violence Technical Assistance Collaborative. I think that's a really helpful resource, and not just to domestic violence specific providers, right? We're all serving survivors of violence in our projects. Can you talk about what kinds of resources are available at the site? And also, we will put in the site in the chat window, so you can safehousingpartnerships.org, so you can go there and see all the great resources that are up there. So can you talk about what they'll find when they click on that link?
Sure. First, let me just mention that there are 5 technical assistance providers that make up the consortium. I'll see if I can name them all without fumbling through that too badly. But NNEDV is one of the providers, NSVRC, NRCDV, NASH, and then Collaborative Solutions are the 5 providers that make up the Domestic Violence and Housing Consortium. And we, on the website, you can find things about coordinated entry, for example. There's been some recent papers and developments around coordinated entry assessments and things to consider when it comes to, many of us know that the VI SPDAT is kind of going away, or at least is maybe needs to be evaluated at a local level to see if it's really effective and really inclusive. So we have some research papers there that you can find out a little bit more about some thinking and some thoughts there. We do a lot of work in the comparable database space. And then one thing I wanted to mention, I'm sorry I forgot to mention it, was when it comes to looking at policies, this is something that the consortium works on as well, is around emergency transfer plans. So many of you know that that is actually a requirement for your COC and your ESG recipients to have a real plan. And one of the things that we found over the last year is that survivors actually really want to move from one state maybe to another to get away from their abusers. So many of the COCs really don't have plans that work across state lines. So this is an area that we can support you in, and there should be some guidance there on the website. If you have questions about confidentiality or safety, those are some things that also we have available on the safehousingpartnership.org website.
Great, thank you so much, Jill. Great resources out there, and again, I encourage everyone to go visit those and check those out, because there's just a lot of really helpful stuff. We're going to move on to the next part of our presentation today, or the next presentation today. So I'm happy to introduce Sharon Singer from the SNAP's office. She's going to walk us through where we are on ESG CD spending nationally, and also walk us through our poll questions. Sharon?
Hi, everybody. We are going to go through the poll questions first. and hope folks have had a chance to respond. So it looks great. So today we're talking about the Emergency Rental Assistance Program that is being rolled out across the country. The first 25 billion. Some communities have already put their funds out, and from what this response shows is that 62% of you are saying that applications are currently being accepted from landlords and tenants. So this is great to hear that is going out, that it's being advertised, and it sounds like there is a small percentage, 19% are saying that funds are currently being awarded, and the other said funds were already awarded, and the process is complete. So it's good news. It sounds like there's motion, like dollars are getting out to help people, and so this is really helpful to hear what's happening locally. And after I'm done with this, I can put in the chat that there are links to all the programs that are up and running that Treasury has put together. Let's go on to the next question. So how have applications been submitted? So it looks like 71% of you are saying that there is a website for both landlords and tenants. It does sound like there is just a handful of folks saying that there is a separate system for landlords and tenants, and a small number saying that there is a call-in system. I'd be very curious to hear what folks who answered other, what that 25% is, what the process is that's being used in your locality or state for soliciting applications. So please share in the chat. Next one. So our last question is just kind of overall, what is your assessment of the ERA rollout? So we've got 12% saying great, everyone's getting what they need. 36% saying good, help is on the way. 40% are saying fair, things are moving slowly, but there has been some outreach. And then we have 12% saying that things are going poorly and there has been little or no communication yet. So again, please feel free to add additional information in the chat. Like I said, I'll put in sort of a link in case anybody is missing information. If you have anything else you want to share, please let us know. We HUD are working closely with Treasury to make sure that this program is successful. All right, so on to ESGCV. So per my usual, we have our report, and this was an active week last week, and in terms of draws. So we saw over almost 25 million was drawn last week, which is exciting, and some from grantees that had not yet drawn, so good news. We are close, but still don't have all the funds in IDIS yet. So we still have a handful of grant agreements that need to be signed and funds put into IDIS. But we have 70%, almost 71% of funds are committed. And we're getting close to that 10% of draws. And just to let folks know, so we've talked a lot about the 20% allocation that has to be expended by September 30th. Grantees are likely to get an email next week talking about that and sort of showing you your status of where you are. So
Sharon, I think we may have lost you. Are you able to connect? Okay, well, we'll go ahead and move on to our next presentation, and hopefully we'll get Sharon back in a little bit. Very happy to introduce Harper Sutherland from the SNAP's office. She's going to walk us through this great ESG CV dashboard. So Harper, I'm going to turn things over to you now. You may be on mute, Harper. Okay, so we've lost Harper. So we are going to do some Q&A here. It looks like there are connection problems. I know there are a lot of storms and weather issues and internet issues all over the place, but we're going to just jump into our Q&A portion here, and hopefully we will get back to our presentations. The dashboard is very cool. So anyway, I wish we could show you right now, but we'll come back to that. The first question I want to get to is, actually we had a question early on about sort of FEMA non-congregate sheltering assistance. So Brett, I wanted to sort of ask you to take on this question, if that's okay. The question is about funding for non-congregate shelter, and specifically about whether there are updates on when is FEMA going to stop reimbursing for non-congregate shelter, and what do we know about the timeframes for those decisions? So can you talk about what we know so far, understanding that FEMA's not here, so but we do talk to them fairly frequently. Can you talk about sort of the state of play here?
Sure. Can you hear me?
I can, yes.
Oh, good. We didn't lose all of us. So obviously, as Norm said, there's a lot up in the air right now, and FEMA is working to put out guidance. So I would expect to see some guidance coming from them. But right now, they have authorized expenses up to 100% for non-congregate shelter, for isolation and quarantine and other reasons. Right now, that period for eligible expenses is set to conclude at the end of September, but they're looking closely at facts on the ground. They're looking at local public health authorities. They're looking at the HHS declaration, and they should be putting out guidance about the end date on when they'll stop reimbursing for non-congregate shelter. In the meantime, though, we know a lot of you are working on demobilizing your non-congregate shelters and trying to close as many of them down as possible. And so really we encourage you to make sure that people experiencing homelessness who are living in those shelters, that you're rehousing them in permanent housing, preventing exits to homelessness whenever possible, using all of the plethora of new resources that are out there to do that. And if you need any help with that, feel free to submit a technical assistance request in the HUD Exchange.
That's fantastic, fantastic update. Thank you very much. So we had on a totally different topic, we had a couple questions about the timing of the COC NOFA, and both the question about when is it coming out, and also will it overlap with the YHDP NOFA? These questions are obviously related. So we don't have a super specific update here, but I do just want to give you a sense of where we are. We are getting very close to publishing the COC NOFA. It's, not days away, but, my best guess is about, 3 or 4 weeks or so. So there will be likely overlap with the YHDP program. Hopefully not a ton, but there likely will be some. And obviously the deadline for the COC NOFA will be well after the YHDP NOFA closes. So that's an update on where we are with the YHDP NOFA. We also have a question here about documentation disability waivers. And so, Marlisa, I wonder if you could talk about where, the question is really about, we have public health officials who are ending sort of emergency measures or public health declarations. Can you talk about, does that mean that communities have to end their use of waivers around things like documentation disability, or how should communities be thinking about that? I'm going to check. Marlisa, are you able to hear us?
I am here. I'm here, just
Fantastic.
slow on the unmuting process.
No worries.
Hi, everybody. So recipients should think of the emergency declaration differently from the special measures that are in place. So if a special measure is still in place for maybe even just a subpopulation, the waiver would still be in effect. So even if your locality, your local government or state has lifted the emergency declaration, if there are still special measures in place, even if they are for specific subpopulations that might be at greater risk of COVID infection, then you should just be sure to document that those special measures are still active and you are still good to go with using the flexibility provided by the waiver.
Great, thank you so much. We're going to try to go back to our presenters and see how we're doing here. So Sharon, are you able to hear us now?
Yeah, I'm
Great.
here. Hopefully you can hear me.
Can you hear me too?
I can hear you all along.
Yes, I can hear you as well, Harper.
Fantastic.
Harper, I was just trying to introduce Harper. So Harper, you go ahead.
Okay, so we were talking about the outreach and how important it is to hit the 20% spend mark. And we have two measures of spending that we can look at. One is based on the IDIS draws, and the other is based on the SAGE expenditure report, which comes in quarterly. And we draw from our IDIS system. We look at that weekly. And so that's what we've been presenting on these office hours is in terms of draws and this data. So every grantee will have access to a PDF 2-pager. It's actually a 1-pager, which is their data and this dashboard. And then the second page will be the key, which explains the dashboard. And here's what the key looks like. And it goes through that. So hopefully people who didn't attend this webinar will also be able to interpret the dashboard. But I'm going to talk about an example of one of those. Next slide, please. Great. So I've redacted the information about the grantee, their name, and their state. So yours would be in that place and all of your data, including the authorized amount. I'm starting at the top in the yellow, the IDIS funded amount, the IDIS grant balance, days since last draws, and then the report date at which we pulled, which will be end of May, early June. So on the left side, we have a net drawn percentage by report date, which is based on the IDIS. And everything in blue has already happened, and that's the draw percentage. And then the computer did a little prediction out until September, October of when you might hit, what your spending might look like based on recent draws. And then there's the 20% in red mark. And so that is the target. And ideally you want to hit 20% by September 30th, if not sooner. And below that in black is the projection on September 30th. And that number is really important. That's what HUD has as our anticipated percentage number. So we can see that this grantee does not have 20% in spending by this time. And that means that they're going to get more outreach and more targeting. On the right, I have the spending gauge, which looks at SAGE. So everything in orange has been reported against is what the most recent QPR showed as spending. And that would be the amount that's written in the font at the center of the gauge, which here is $3.12 million. And then there's a purple line of target, and that's 20%. So ideally that would be $6.65 million. And so yeah, we see that they have not met their expenditures, neither by SAGE nor by IDIS. Most of the grantees, it's the same. No. There's very few. Yes, you've met it on SAGE, but you haven't met it in IDIS. But either of those are going to be what we're looking at in terms of meeting the 20%. And okay, so let's explain the funnel chart in purple. The current authorized amount, and then the 20% of the authorized amount, which is the target to hit. Then the third bar is the gap, the remaining amount that needs to be spent to meet 20%. Here it's a sizable chunk. It's nearly half, actually. And then the monthly spend target is how much you should spend per month of June, July, August, and September to meet that. And that monthly spend target in the bottom, the fourth bar, is also repeated on the left in black as the monthly spend target. So basic budgeting, if you spend this much per month, you will hit 20% by September 30th.
Great, thank you so much, Harper. Just to reiterate, HUD's going to be sending these out to recipients, so if you're an ESGCD recipient, you will be receiving one of these. If you look at the chart and you're a little concerned about how your lines aren't quite going where you want them to go, please feel free to reach out to us, and we'd love to talk to you about ways to speed up spending, and also we have some technical assistance available to help you just work through whatever issues might be slowing things down. It might be documentation, it might be putting together whatever you need to make those draws, or whatever it is. We'd love to help you. Work through it. So thank you very much, Harper. This is a great dashboard, great resource for communities. So we're going to go back to some of our questions here. We had a question about there's a new child tax credit, as we learned about last week, and there are some questions about how we count that as income in both in HMIS and in projects that require some sort of documentation of income. Brett, I wonder if you could talk us through, does the child tax credit, should it be counted as income when we make these sort of eligibility determinations?
Sure. So the monthly payments that were included under the Child Tax Credit Program of the American Rescue Plan, those don't count. They should be excluded from the annual income calculation, which follows a history that we've had throughout the pandemic of excluding a lot of those extra payments that folks have been getting from annual income.
Great, thank you so much. I do want to acknowledge there was a great suggestion made in the chat window about doing a presentation on the Education for Homeless Children and Youth funding. There was, I believe, about $800 million appropriated recently for services to students experiencing homelessness. We're working on it. We will try to get some resources, including maybe a presentation on a future office hours available. I will also note, if you're subscribed to our listserv or the USICH listserv, we have sent out some stuff about webinars and such that have, I believe, already happened that explain that funding for us. Let's see if we have any other questions we want to address here. So we do have there's a question about the waivers for the COC and YHTP program. There are a special set of COVID waivers that are expiring at the end of June. Brett, do you want to give us, I know there's I don't think we have a for certain update here, but can you give us a rough update about whether those are going to get extended or not?
Sure. We are putting together a package to start extending some of them. I think we are getting at a point where social distancing measures are being lifted. And so I think we're going to start to see some of them that are reliant on social distancing measures start to phase out. So I would start thinking about how you might staff to go back to things now that we can be in person where people are vaccinated safely.
Great, thank you so much, Brett. So I think we're done with the questions we're able to answer here. I want to give a very special thanks to all our presenters today. Especially want to thank Andrea for giving us a great presentation on serving survivors of domestic violence. Thank you so much for that. Want to thank all our technical assistance providers, the SNAP staff, incredibly helpful information here. And I definitely want to thank everyone who joined us for the office hours today. Thank you for your incredible work, and we just very much appreciate your partnership as we make it through this pandemic and as we work to end homelessness across the country. So deeply felt thank you, and I also want to wish everyone a great rest of the day, great weekend, and that concludes the webinar.